You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, 6-month smiles, very popular procedure that is changing people's smiles. It's adult orthodontics, and it's accelerated to as little as, actually it could be less than 6 months. And according to my first guest, who is doing it here in San Diego, it is a great option for people to save money. Instead of getting expensive veneers, maybe an option to straighten those teeth. With us, we have Dr. Malone. Dr. Malone, welcome to the program.
Hi, thank you. Glad to be here.
Now, before we get into today's topic, tell me a little bit about your practice. Who's your typical patient, and what are the procedures you do?
Okay, sure. Generally, as a general practice, with a bent on cosmetics, and our patient age group runs from probably very young to very old, and depending on what their needs are, we try to address those cosmetic needs.
Okay, and so what are the procedures you do?
Procedures we do, again, run the gamut from general dentistry, things that people typically associate with dentists, to cosmetics. We do sedation dentistry for those with any kind of fear. And we do, like you mentioned, 6-month smiles, veneers, crowns, whitening.
So your background and training, tell me a little bit about that. I know you went to this Las Vegas Institute, which is so after dental school, and when did you know you wanted to be a dentist? So I guess there's a few questions right there in that question. But
I think I was a sophomore in high school.
Really?
And I was glad that I made it, because I don't know what else I would have done. So I love dentistry and love working with my hands, and so I just decided dentistry versus medicine. I liked the sort of the area of dentistry and using my hands, and so went to dental school, graduated, and decided I didn't want to live in Chicago anymore, which is where I'm from, and so I took the boards out in California and been here ever since.
Okay, good, good. Yeah. Now, 6-month smiles, how did you get involved in that? What is it? Who's a candidate?
Okay, I'll almost say everybody, but definitely there's people that lean towards that. Some people are still candidates for orthodontics, and so it just depends on what their needs are and what their goals are. If if they're just interested in the cosmetic aspect and they're not having any major problems with their bite or TMJ problems, which are the joint problems, then they're a candidate.
So why is it, though, it can be done where traditional orthodontics, I guess, is 2 years?
Yes, or more.
And 6 months is just 6 months. I mean, what's the difference? Is it the materials, the technique? What is it?
It's a little of all of that. Primarily, it's a matter of, again, the goals. Our typical patient that wants 6-month smiles doesn't want to spend 2 years or more, or they've relapsed from previous orthodontics, and their main concern is the cosmetic aspect of it. And so that's their motivation.
So how long have you been doing it?
Oh, I've been doing it probably about 3 years.
What do you like about it?
I like the seeing the results, and the look on people's faces, and in retrospect, how easy it was for them. Typically, we tell a patient they come in for a cleaning, we say, you could have straight teeth by your next cleaning, and they just don't almost believe that. And
it's a good line. That's good.
Yeah, and so we tell them or show them cases of similar to theirs, and then they start becoming more believers of it. And even if they came in, for instance, wanting something else such as Invisalign, we explain the differences between them and what the advantages are of each, and usually they go with the 6-month smiles.
Now, what do the orthodontists say about this?
I haven't had a lot of contact with them about that. I work very well with my orthodontist, though, and again, if a patient really needs comprehensive orthodontics, because 6-month smiles won't cure everything, then we refer to the orthodontist.
Okay. Do you do other things in your practice for straightening teeth? I mean, do you, like Invisalign?
We do Invisalign as well. It's just that this is a more precise way of doing it. It usually costs less, and the results are, more pleasing, I think.
Do you like it better than Invisalign?
I do.
You do?
I really do. Because from a practitioner's standpoint, it's more controllable, more predictable, and I can say with greater confidence what the results is going to be.
Okay. Now, what are the age ranges of patients getting 6-month braces? Because I guess the older, if you're in your 40s, aren't you worried a little bit about braces? How it's going to make you look?
Yeah.
Or, what are the
right? Basically, from teenagers to 80. Yeah.
Okay.
I have
80-year-olds are getting 6-month braces?
Absolutely.
Is that legal in this state?
As long as they have teeth.
He put braces on my yeah, I could just see that. So no, really, your oldest patient is what? And why would an 80-year-old want 6-month braces? You tell me.
You know, it's something they say to you, I've always wanted straight teeth. I've raised my children. I've, you know, done all the stuff. And now it's my turn.
Okay.
Or it's a supplement to, I guess, other work that they are having done, cosmetic work.
Is it mostly men? Or I mean mostly women?
Mostly women.
Why do you think that is?
I just think women are more oriented towards, you know, their appearance. You know.
Okay.
Men are more functional, and so they just want to have it done. You know, they're having lots of procedures done, cosmetic procedures, and they're just adding this to their list.
What do you want people to know about? Like, you know, I invited you into the studio to talk about 6-month braces, and when you're thinking, this is what I want the public to know about 6-month braces, 6-month smiles.
Really, how easy it is, and how life-changing it can be. I've had people that never smiled. You know, I had a guy who had a mustache that actually covered his upper and lower lip.
Okay.
And it never really put it
like
together.
Like a walrus, right?
Yeah, like a walrus, yeah. And I never really put it together until we finished. And he shaved his mustache off. And then he admitted the only reason he had the mustache was he hated his ugly smile.
Is that right? Did he ever go and lay out at the La Jolla Cove? Because that would be dangerous for a guy like that. Because those mustaches, upper and lower, that's a long mustache.
Yeah, I mean, it was very unique, let's put it that way.
So the frequently asked questions. Okay, so they come in, and do you do any advertising on the 6-month braces, or pretty much you mention it to the people that are in your practice?
A lot of it's just word of mouth.
Word of mouth, okay.
Yeah, we are now starting to do more, you know, outside advertising.
In this economy, why invest in your smile?
Well, lots of reasons. You know, confidence. A lot of people now are looking for jobs, and you know, like it or not, people are judged by their appearance, and depending on, of course, what kind of a job they're looking for, it's an advantage to them to have a good smile.
Do you see transformations in your practice?
Absolutely.
Because you say it's life-changing.
It can be. Yeah, it can be. I mean, you know, you have people who, after you do it and you show them the mirror, you know, they say, nice, as opposed to people who are just in tears. I mean, those are the ones I like. You know,
right?
For a dentist to say you like to make people cry is probably not the best thing to say. But when there's tears of joy, it's just so satisfying.
Are people afraid of the dentist still? I mean, there's a lot of people with crooked teeth walking around.
Yes.
And but they do nothing. What's your take on that?
Yeah, there's definitely a fear there. A lot of it is based on probably misconception, you know, because there are so many things that we can do now that make dentistry comfortable, sedation dentistry, just reassuring them, just listening. It's amazing how calming it can be just to hear their story and to listen and to understand what their past, perhaps bad experience was.
So I think you mentioned, is it oral sedation, IV sedation you're doing?
Just oral sedation.
And not every dentist is doing oral sedation. Is that right?
No. We use nitrous oxide, and they take a little pill. They just relax. They don't really fall asleep like general anesthetic. And then it has an amnesia effect, so they know they were there. They don't quite know what went on, and that's not a bad thing.
It's pretty easy procedure. And so what else do you have going on in your office that makes for a good smile?
It makes for a good smile. Well, when we have a person come in for a consultation, a lot of times that's just a complimentary consultation. We talk to them about what their needs are, and then based on what their needs are, then we would formulate a treatment plan. It could be 6-month smiles, as we're talking about. It could be just simply whitening their teeth, you know, a very conservative thing to do. It can be veneers or crowns. It could be a smile lift.
Okay.
It could be many things.
What, you know, you're a dentist, right? Mm-hmm. So you probably think that the smile's pretty important. How important is the smile? Somebody watching this.
I think it's, as I said earlier, life-changing. I would explain to women sometimes, you know, if you're concerned about appearance, I think it's about 1/3 hair, 1/3 eyes, and 1/3 smile. Okay. And so they can literally change their life by 33% just by improving their smile.
Improving their smile. Final message, somebody out there considering, you know, they have crooked teeth, but they want to do something about it. What's your message to them about 6-month braces?
Well, my message to them would be to give yourself a chance. Come in to your local dentist or to our office and just tell us what your concerns are. Non-threatening. We don't even do it in a treatment room. We do it in a room that's, you know, just neutral, and just listen. No commitments. And if you decide to enhance your smile or appearance, you'll never turn back. I think the typical comment we get is, "Why didn't I do it sooner?"
Okay. And 6-month braces, are some people done quicker than 6 months?
Absolutely. 6 months is an average. We have cases that we've done in 3 months, 4 months, some as many as 9.
But it does sound long. What about the critics that say, you know, and I'm thinking about this because I look at advertising, right? Mm-hmm. And I hear, you know, teeth in a day and everything's in a day and a day and a day and same day this and same day that. And 6 months, that seems like a long time.
Well, it's all
relative. What's your response to that?
It's all relative. You know, a typical orthodontic case is 2 months plus, 2 years plus. I've had patients come and say they had braces 2 or 3 times, you know, up to 6 years. Not typical,
really?
But
okay.
Yeah. So 6 months, as I mentioned earlier, you know, between cleanings and you're done. And most people can relate to that. They don't think that's a long time at all.
Okay, so go in, do something about it. You offer a free consultation.
Absolutely.
They meet with you one-on-one.
Yes.
And you have financing available. And
we have financing available. We have many before and after pictures of cases we've actually done. And so they can see a case similar to theirs and what can be done.
All right.
Yeah.
Well, I want to thank you so much
Very
for coming
good.
on the program. Very
right.
interesting.
Thanks. Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you have crooked teeth, you could see Dr. Malone, about 6-month smiles. For now, I wish you good health.